Hi guys, this is Cristian from ArtSmiles, and I'd like to introduce you to another case that I just completed this case. I delivered the mouth guard this week, and it's been about 10 or 11 months of treatment, and I'm going to explain that now. Okay, so for this patient, we had to have a more comprehensive treatment plan that was composed by bone graft and extractions, and then implant surgeries. We placed 6 implants for this patient, and we had 2 waiting periods during that surgical phase for the healing of the bone, and then after that to do the mock-up, temporization, and the cementation of the case. All right, so let's start with the planning. The patient, his first complaint was that he couldn't eat properly because for the absences of multiple teeth in the back, and in the upper arch, the teeth that were still in the mouth were not very good. He had some infections around the back teeth in both sides, and we had to address that issue before we planned for implants. Of course, that he was concerned about this, the cosmetic as well. He had a fall when he was a child, and root canal has been done at that moment, but the root canal wasn't, there was a failure in the root canal. I can show you an x-ray in a moment, and we plan to remove that teeth as well and place some implants. Here you can see the cosmetic problem we had in the front, the gaps in the back. So you imagine how difficult it was for the patient to socialize, and about the self, the confidence in himself, all the problems that dental his teeth were causing for his life. And here you see a problem that when we lose back teeth, there is something that happens right here in the front. If you see, his lower teeth are finishing here, very, very close to the gum line. That means that once we lose the support of the back teeth, the frontal teeth, they tend to cause an overbite. So the treatment plan was composed to deliver a new height for this bite for this patient. So we give support in the back, raise the bite, and give a better outcome, cosmetic outcome in the front teeth. This is the X-ray, and the initial X-ray. This teeth had to go, this one had to go. We removed this one, this one. In this area here, I knew that this is just a 2D image, but I had a 3D image for this to take this teeth out. There was a massive infection here. It was going all this way up to here. I had to do a large bone graft in this area here. Remove this four teeth, do a large bone graft. This area here on your left side here, right side of the patient, of course, we had also infections in these areas, and I had to remove these teeth and do the bone graft. After doing bone graft in both sides, I waited for 6 months just to be sure that the bone was going to be mature to place the implants. While we were waiting for the bone graft to mature here in both sides, I took out this tooth and this tooth here, and we placed 2 immediate implants in that area, in those areas. Here we had a small infection, and here as well. As you can see, the root canal was pretty large in this teeth, which tells me that he was a child when he had a fall, and because the tooth was the teeth were still in formation at that moment. But now we couldn't maintain those teeth. It would be much more predictable to take out those teeth and doing two implants in that area. So after this is the these are the x-rays after placing the implants. You see those implants in the front, implants in the back, and sorry, I'm in front of the other implants in the right side. So this is the provisional. The provisional is a provisional. It's something that we do quickly in the chair, and it gives us a rough idea what to expect from the definite. And we can see a problem here with the provisional, and this is what I was fixing. I fixed during the provisional phase before we place the definite crowns. If you see this part here, compare this area here with the right side of the patient, left of the photo. If you see here, we have a good buccal corridor, but we had a deficiency here. This is something that sometimes happens when we are placing, when we are fitting the provisional, especially this one that I do in chair. Sometimes if the way how I put the mold shifts a little bit, we have this problem. Or sometimes it's difficult for the lab to be very accurate when we are doing multiple teeth at one time. But once I take the photo, I communicate that to the lab, and I had to raise this area here. I just put some composite in chair, and just for the patient to bite properly. And then we move on to the definite crowns and bridges. So we worked from here up to here. Okay, so I placed this is a bridge on implants. The two implants are beautifully placed there. Two more implants in the front and two unitary implants here. Everything's very stable and good to place the definite crowns. So I scanned the mouth of the patient, and then we did the final. We installed the final crowns. I'm so sorry. I'm in front of the photo here. But here you can see the final outcome of the patient, and he's really happy with this the outcome that we've got. It's stable, and as I said yesterday, yesterday I installed I gave him the mouth guard. The mouth guard is the last part that we do. It's just because he's a grinder as well. We always go with with a mouth guard to protect the crowns and the bridges, and to give a steady, a stable long-term result for this case. All right. So this is a beautiful case that we just finished. I'm really pleased to have done this case for such a nice guy, and now it's a new life for him. And I hope I could help you some way to give you some glance of what we do here at ArtSmiles and with oral rehabilitation. If you need any help, please contact us, and I'm happy to help. Thank you.